Every 3 seconds, someone suffers from a fragility fracture. There are approximately 9 million of these fractures across the globe annually. Joining me now to teach us what we can possibly do to prevent these fractures from happening is Dr. Elise Gordon, a primary care sports medicine physician with Andrews Institute Primary Care Sports Medicine. Thank you for being here.
Thank you for having me.
Well, that's all a big mouthful. First of all, tell us, what is a primary care sports medicine doctor?
Primary care sports medicine doctor is a primary care physician, so your basic residency is in family medicine or pediatrics or ER, internal medicine or physical medicine or rehab. And then you do a fellowship in sports medicine, and I'm a family physician who's done a fellowship in sports medicine, and so I primarily see musculoskeletal with some other primary care sports-related issues as well.
Okay. Now, I know there's a perception out there that may be incorrect. Now, everyone's can come to the Andrews Institute, right?
Anyone can come to the Andrews Institute.
I think a lot of people think it's really for professional sports, but
no, I mean, I see patients. I see from kids to, I have 9-year-olds to 90-year-olds, and anybody that has a musculoskeletal problem really can be seen at the Andrews Institute.
Okay, great. Well, let's talk about then the fragility fracture. What is that? A
fragility fracture is a break or a fracture in someone, usually 50 or older. I know we love that number. When, from a very simple accident where you wouldn't expect a fracture to happen. So it has underlying osteoporosis. That's kind of the signal that it gives us. And usually you break a wrist, a shoulder, a hip, or a compression fracture, so a squishing fracture in one of your spinal vertebrae.
Well, you mentioned osteoporosis. What are some other risk factors, and how could somebody determine if this might be something they need to really be aware of?
In fragility fracture, we're talking mostly about secondary prevention, identifying people who have had a fracture and then making sure they don't have a second. But in primary prevention, especially working with their own primary care physician, usually women 50 or older, or men sometimes 65 or older in general, can start looking to see if they have any osteoporosis. And you start out with evaluating vitamin D, a DEXA scan, a bone density scan. But people also who are smokers, have thyroid disease, and there's a whole list of other underlying where you might want to look at a younger age to determine if there's any risk of bone thinning, osteopenia, or osteoporosis, where it's actually pretty less dense.
Well, how does this complicate or become more complicated in the future? Like, what's the total picture of this? I've always heard that once someone breaks a bone, especially a hip, that it's really kind of unpleasant from there on out. Yeah, so tell us a little bit about why it's so important to prevent that.
The hip is probably the most serious. That's the one where we've done some research and data that shows that the mortality actually goes up after a hip fracture. And also, only about 40% regain their pre-fracture level of independence after a hip fracture. Wrist fracture, not as much, but the concern is if you've had a wrist fracture or shoulder fracture, are you at risk for that hip fracture? And then spine fractures, also, risk of pain and just all the associated with some more chronic pain after that as well.
And how can this pain or these other issues really kind of get to the issue of affecting someone's quality of life? Because that's what we want everybody to do, is have a great quality of life.
Absolutely. Well, a hip fracture will affect walking. And then that kind of, when walking's going, I mean, it's not even a matter of can you drive or anything like that. It's just getting around, doing your normal things in your daily life, even just getting up, going to the bathroom, making your meals and things like that. Spine fractures as well, because standing, that's what we do to get around. That's part of how we live. Upper extremity, meaning your shoulder or wrist, not as much impact from the standpoint of daily living, because especially if it's your non-dominant hand, you can usually regain some use of that arm enough so you can do everything you need to do. But the concern is we want to make sure that the reason you had the fracture wasn't from osteoporosis and then put you at higher risk for those more serious fractures.
Well, and our technology is always changing. What are some new innovations of how you treat people who have had these? You're talking about the secondary, effects or the secondary issue. What do you see, and what's the typical prognosis?
Well, in treatment for osteoporosis, there are several different medications out there, and they're developing new ones as we speak. So some of the more common ones are the group called bisphosphonates, which you can either take by mouth or by injection, and there's some other groups that we've developed. But the good thing is that there's, or maybe the bad thing, because the hard part is that some of the basic ways for prevention is diet and weight-bearing exercise.
Okay.
And strength training, resistance and balance to prevent falls.
And how do those preventive things that you said to prevent falls, but is that to build up muscle density? How does that help prevent the falls, the exercising, the diets and all?
All of the above. Weight-bearing exercise improves your bone density, because anytime there's stress on the bone, the body wants to lay down more bone to protect it. So weight-bearing exercise, which means walking. I'm not saying that you need to become a marathon runner, but at least walking, as opposed to swimming. Swimming is a great exercise for full body, but you need to also have some weight-bearing exercise in there as well. Balance training and strength training is, as you get older or become more deconditioned, no matter what age you are, you lose some coordination and control, and you get a little weakness in some of the muscles, and then also joint control. If the muscles are weak enough, that puts you at risk for falling, which then leads to the hip fracture primarily, or the wrist or the shoulder fracture.
Well, if someone feels that they may be at risk, or of course if they probably had a fracture, they probably know something is not right. But what would you suggest to someone who needs to have something looked at?
Well, first you start with your primary care physician. That takes care of you normally, and figure out if you're someone at risk, and if you've had the workup that you need to evaluate you for osteoporosis. If you're someone who's had a fragility fracture, one of the things you're trying to do is, I'll help a lot with that workup. Sometimes I see those people in my course of my practice. I'll see wrist fractures and arm fractures, but often they'll come through a surgeon, because a hip often will need pinning, or the spine fracture will need to see a spine surgeon. But from there, from the spine surgeon, then you can come and get evaluated to see if that was truly a fragility fracture. And almost by definition, you know, in the 50 and older age group with, you know, just from a regular fall, that's going to be a fragility fracture. And kind of determine how far along the path you are. Do you need medicine, just diet change, exercise change, physical therapy to get back to your normal level, and then physical therapy to kind of build your strength so you don't fall again, and make sure that you're walking and everything is where it should be.
Great information, quality of life, keep them walking. Huh?
Absolutely.
Okay, well, thank you very much for being here.
Thank you for having me.